Most of my patients who don't move well or really stiff usually have posterior compression of the pelvis. And this affects up the body and down the body. So usually when I'm starting with somebody, the first thing we do is try to decompress that pelvis. So let me turn this around, I'll show you what I'm talking about. So here's the back of our pelvis. So we got our ilium, our sacrum, our ischial tuberosity, and our hip. You see there's a nice little gap here, everything's opened up, and my hip is in a good neutral position. When we have posterior compression, the sacrum has tilted backwards and the ilium has flared forward and out. And you can see how that closes off this gap here and shortens all those muscles in the back of the hip. All right, the biggest cause of this I see is improper sitting. So when we slouch, when we sit, we literally do that exact same thing. If you're sitting on your sit bones and you slouch backwards, you're tilting your sacrum back and those sit bones are tilting in and thrusting your hips out. So if I'm sitting here and I'm slouching, watch me try to bring my hip back into internal rotation. I can't. All right, and no amount of exercises or work that I do is gonna make it go back in. So if you are really cranking on trying to get internal rotation of the hip, doing a bunch of exercises, stop until you do this decompression technique, because you could be injuring yourself, either possibly injuring your labrum or creating some bone spurring or some impingement. So try this decompression technique first, and then let's see how your hip internal rotation looks. Okay, to decompress the pelvis, you're gonna lay on the ilium. So if it's compressed back here, you lay on that ilium, and you can see it's gonna open everything up. All right, what you're gonna do, you're gonna lay on the foam roller on that pelvic bone, not on the hip, and you're just gonna rotate your body over that ilium and lay there and breathe. All right, it's the easiest thing you can do. You just gotta lay there, breathe, and relax. It will decompress your pelvis, and you're gonna feel amazing afterwards. So let me demonstrate. Once from the back, once from the front. So I'm getting on that pelvic bone, pillow for my head. My knees are gonna be up. I'm gonna posteriorly tuck just a little bit, and then I'm just gonna roll my body over that ilium ever so slightly, and just sit here and breathe. Try to relax, don't tense anything up. Okay, again, about 5 to 10 breaths. I'm gonna turn around and show you in the front. The only thing you can do wrong on this is to be rotated backwards. That's actually going to jam your pelvis forward more and make it worse. So it's very important that you roll your body over and almost get a little more rotated forward than you are backwards.